we're discussing the link between your general health and your oral health, like that many people don't see. Could you please tell us a little bit more about that?
Yeah, so there is a lot. In the past, people would just think that oral health is oral health, but
Yes.
now more and more people have come to find that there is a major link between your oral health and your general health. So just to start with is some of the diseases that present in the mouth. And I'll just try to be very simple. If you talk like gum diseases, so you see when you have your teeth, you have the gum and the bone that surrounds the teeth.
Yes.
Now, it's been found that people who have gum disease, for example, there is a correlation between gum disease and problems like diabetes. So you will find that if somebody has diabetes and they have uncontrolled gum disease, their sugar control of diabetes will not be very good. So therefore, but it's been shown that if you actually go ahead and manage the gum disease and it's well controlled, then you will also get that the sugar is also controlled, of course, alongside the other measures that are go along in managing diabetes. So diabetes is actually more one of those lifestyle diseases that now more and more with the understanding that comes in is something that people really want to manage because it's one of the leading causes of, you know. The other problems that also present in the mouth is like dental caries, that's tooth decay. If you've ever had a toothache or you have a tooth that is problematic, of course you will always want to choose the softer diets that you are eating. You don't want, and we are now told you need to eat food that is rich in fiber, nuts, and all that. But you are not going to eat that if you actually don't have teeth that are functional.
True.
The other thing is if you have teeth that don't look nice, you know, there is the link between the psychological well-being of a person and the oral health. If, for example, you have a mouth when you feel like you want to tell somebody, you want to whisper in their ear and they don't want you to
Wanakwambia
whisper in
to
their
know,
ear.
just say it loud,
Say it
no,
from
no,
where you
no,
are, you
say
know.
it loud.
Yes.
Yeah, so psychologically, if somebody knows that they have, for example, a mouth that is having a foul smell, that could actually affect them. So the other things that, especially now we have come from the COVID era, it was shown that people who had COVID, who had gum diseases, if they contracted COVID, most of them likely ended up in the ICU, and the outcomes were not very good. So there is a correlation between upper and lower respiratory diseases and oral health. The other one that is funny is things like erectile dysfunction. It's actually been shown that it's more prevalent in people who have gum diseases than those who don't. So you see that is
it's a 360. Yeah.
So umesema hata maneno ya mechi kidogo inaweza
inaenda
because
chini
of
kabisa.
your oral well-being.
Yeah.
Sometimes we don't see the correlation of that,
Yeah.
but what are some of the remedies that you can actually offer? Because there's so many people who are listening right now, they're going through the same, and sometimes it's more like taboo topic. And my trivia for you was, how do you tell someone you have bad breath? Like unanuka mdomo, how do you tell it without sounding rude and outright?
I think that's a good question. I'll just come to that briefly.
Yes,
the other thing I forgot was the correlation between low birth weight. If a woman is expectant and they have poor oral hygiene, it's been shown that they're likely to give birth to a child who's below the expected weight. And so there is a big correlation that women who are, or a big encouragement to women who are expectant to ensure that their oral hygiene is good.
Remedies.
Yes. Now let's go to the remedies. You were asking about how to tell somebody who's having bad breath.
Before that, like you've mentioned a lot of things.
Yeah.
But we would like to know what are the remedies for such. How do we respond to
oral health problems? Yeah. So the first thing and the main pillar is prevention. Now that's why all the time we are visiting schools, like now the Kenya Dental Association and other institutions, and even at Lions, we are trying to tell people the need for prevention. Okay, so the first thing is oral hygiene, and this is what the patient or each person does at home. We've talked about the frequency of brushing. You need to brush in the morning after breakfast. You need to brush in the evening before you go to bed. The other thing that needs to happen is flossing, because remember, Brian, when you brush your teeth, you have not covered the areas in between the teeth.
Yeah.
So you need to do what we call interdental cleaning. And the main thing that we use is the piece of thread. I brought some here.
Some floss, yes.
Yes. So you do dental flossing, that's cleaning in between the teeth, and usually we encourage that you do that once evening before you go to sleep. There are people who have gum diseases, so the dental flosses may not be as effective. Those ones we would encourage them to use interdental toothbrushes. Usually your dentist will check and tell you which size is best for you because they come in sizes.
Okay.
There are also people who have, we call them periodontal pockets. That means the cavities are quite, the areas around the teeth, they are not readily available, accessible to the toothbrush. In which case they might use something called an oral irrigator. An oral irrigator is basically like the pressure car wash.
Yeah.
So it comes in with a jet of water that can clean under the gums where we cannot reach. So those are some of the aids that can be done. Mouthwash, brushing your tongue and all that. Those are some of the things that you can do in terms of hygiene. Then the other thing is dietary control. Things like dental caries or tooth decay is a principle of about diet. If you are taking sugar, the sugar remains on the teeth, then for sure you are going to get dental decay. So we encourage that you regulate not only the amount but also the frequency of snacking. We encourage people that make sure you have proper meals, because if you don't have a proper meal,
you crave the sugar,
Uko nayo, sweetie,